Hello, thank you for joining me in this educational series called Get Back to Life with Reflex. I'm your host, Dr. Russ Riggs, the Medical Director at the Reflex Knee Clinic in Portland, Oregon. This is an educational series about knee health and how we can help improve our communities one knee at a time. Almost everyone knows someone who has knee pain or who has had a knee replacement surgery. Like my mom used to say, an ounce of prevention is worth a pound of cure. And that is very true when we're talking about knee health. We are facing an epidemic of knee pain due to three converging factors: an aging population, an obesity epidemic, and an unprecedented number of knee injuries. Back in the 90s, our society became very sports-centric, and parents were pushing their kids to be more competitive in sports. That resulted in a rising number of knee injuries, which often leads to knee problems later in life. The final common pathway of either injury, obesity, or aging leads to the most common cause of knee pain in the world, which is a condition called knee osteoarthritis. This is also the most common cause of knee replacement surgeries. The number of total joint replacements is skyrocketing. We currently are performing about 1 million of these surgeries each year in the United States. It is predicted with our aging population that this number will grow to 3 million by the year 2030. That is a tripling in the number of total knee replacements in the next 10 years. So at no other time have non-surgical treatments become more important than right now. What is knee osteoarthritis? It is a relentless, progressive, destructive process that eventually results in complete joint failure and disability. The lifetime risk of developing knee osteoarthritis is 45%, meaning that almost half of the people in the United States will eventually be diagnosed with this condition. The more we understand it, and the more we understand how to prevent it and slow progression, the healthier our communities will be. One thing that makes knee osteoarthritis such a terrible condition is that most people don't even realize they have it until irreversible destruction has already taken place. In fact, 40% of people who already have structural damage to the joint have zero symptoms. Since cartilage tissue, which is the cushioning specialized tissue on the ends of bones, has no blood flow, it has no healing potential. Any cartilage damage, therefore, is irreversible. And this underscores the importance of early diagnosis and treatment and prevention. Unfortunately, there is no cure for this condition. Although there is a lot of research going on all across the globe in a frantic search for a cure. Until then, we need to do our best to slow the progression, halt the damage, so when that cure does come, we have a healthy enough knee to take advantage of the cure. So the current goal in 2021 is to slow the progression of the disease until a cure is found. The key to a successful approach to knee osteoarthritis is early diagnosis. that is when the treatments have the most impact and are more likely to be successful. Unfortunately, many people wait until their symptoms are so severe before they are seen or evaluated by a medical professional. By the time their knee pain is evaluated, damage has been done, and oftentimes the joint is beyond repair. In the later stages of knee osteoarthritis, treatments are not as effective. One big breakthrough in the ability to diagnose knee osteoarthritis earlier is the use of musculoskeletal ultrasound. That is using an ultrasound machine to look within the joint, to look at the supporting structures, the lining of the joint called the synovium, as well as the cartilage itself. Ultrasound is able to detect cartilage changes early, many years before it can be seen on MRI or X-ray. Ultrasound also increases the accuracy of treatments. If an injection is needed to treat this condition, ultrasound helps the provider guide the needle to ensure that the treatment is reaching the right location. There is research showing that blinded injections or unguided are far less accurate, even in the hands of an experienced professional, than when ultrasound is used. At our clinic, 100% of our procedures are done utilizing this technology. What else can be done to slow the osteoarthritic process? One treatment is hyaluronic acid injections. Sometimes this is called joint fluid therapy. It is also known as viscosupplementation. What it is injecting a synthetic joint fluid into the joint that helps shut down production of inflammatory mediators and cools down the level of inflammation inside the joint. This, although it's not a cure, can help protect the cartilage, providing additional cushioning and lubrication and protection to the cartilage. Another consideration is an offloading bracing system. These highly engineered bracing devices are able to offload the part of the knee where there's the most damage, allowing it to also cool down and to slow further damage in that area. And many people already are aware of total knee replacement surgery, which is used as an end-stage treatment. As a medical professional treating knee pain for 10 years, we focus on non-surgical treatments, back to that first quote, because an ounce of prevention is worth a pound of cure. If the condition can be diagnosed early enough and treatments are administered, it's like putting the brakes on this process, slowing the destruction of cartilage and prolonging the life of the joint. Other treatments are exercise, weight loss, physical therapy, and of course anti-inflammatory medications such as ibuprofen and others. With the increased side effect profile of these medications, we try to help people get out of pain without putting the gastrointestinal system, stomach lining, or kidneys at risk by using other therapies. A newer treatment is called platelet-rich plasma therapy, or PRP. This has been around for about 2 decades and initially was only accessible to elite athletes in Europe and other places. Over the past decade, it has become more and more common here in the United States, and the amount of research on platelet-rich plasma has literally exploded. What does PRP do? Well, as mentioned earlier, cartilage has no blood flow. And because it has no blood flow, platelets are not delivered to cartilage. And platelets, as we now understand, are the conductors of the symphony of healing. Without platelets, there is no healing. Since cartilage has no blood flow, it has zero healing potential. So platelet-rich plasma therapy is harvesting a sample of blood drawn from the arm of a patient, separating out the platelets, and then injecting those platelets back into the joint. When those platelets get into the joint environment, they shut down production of inflammatory mediators. They also trigger production of a healthier joint fluid, which helps to protect and cushion the cartilage. PRP has been shown to be highly effective, and there is ample research supporting its use in knee osteoarthritis. In fact, PRP is a treatment I receive regularly, even though my symptoms are minimal. I get a little knee stiffness, but I still get treated on a regular basis because my goal isn't symptom control. My goal is to prevent and avoid ever needing a knee replacement surgery. One question I am asked frequently by patients is whether or not walking or other activities will actually increase the damage in people with osteoarthritis. The answer to this question is a resounding no. Research is very clear on this topic, and that is that walking is the single best activity that anyone with knee osteoarthritis can engage in. In fact, the recommendation is walking 20 minutes a day for 5 to 6 days a week. And this is something I have challenged countless patients to do, and I try to do myself. We're going to talk a bit about the vicious cycle that patients get into when the pain from osteoarthritis starts to increase. As pain in knee osteoarthritis increases, a person's activity level decreases, and that often results in weight gain. In fact, the average weight gain in someone with knee osteoarthritis is 42 pounds. Because with each step, the knee will handle 4 times our body weight. That is an incredible load. I weigh 150 pounds, and I'm not a big guy, but my knees are handling 600 pounds of force with each step I take. So it's hard when someone gains 42 pounds, that's an additional 400 pounds of force that the knees were not experiencing before. The other thing that has emerged in the research on obesity is it's not just the increased load that is affecting the joint. We now understand that adipose tissue, or fat cells, release pro-inflammatory mediators into the bloodstream, and that these mediators not only affect joints, they also affect the cardiovascular system, leading to heart and vascular disease. They are linked to diabetes and also dementia. Obesity is more than increased load. Fat tissue is now looked at a giant endocrine system that dials up the systemic levels of inflammation. The positive side of this is that research shows if someone will just lose 10 pounds, knee pain symptoms can be reduced by up to 30%. So people ask me, what can I do to lower my risk of needing a joint replacement in the future? There are several things that a person can do. One, be evaluated by a knee expert to see if you have the condition, even if your symptoms are mild. Symptoms of knee osteoarthritis in the earliest stages are often very subtle, like some stiffness after standing up, after prolonged sitting, or sitting in a movie theater. But people generally ignore it because within a few steps it goes away. Anyone who has a history of being an athlete is at high risk. In fact, in men, prior injury is the #1 risk factor of developing knee osteoarthritis. So anyone with an athletic history should be evaluated sooner rather than waiting until the symptoms are severe. One very interesting fact is that after an ACL injury, which the top demographic of where this injury happens is 15-year-old female soccer players, within 10 years of that injury, 50% of those girls will have signs of osteoarthritis in their mid-20s. This is why early diagnosis and evaluation of knee symptoms early on is so important, because if we can identify the condition, then the treatments are successful in reducing inflammation, and in the setting of reduced inflammation, the cartilage damage is slowed and the life of the joint is prolonged. Other things people can do is, if you're packing any excess weight, lose 10 pounds and do it in a sustainable manner. Avoid processed foods. They are extremely pro-inflammatory, and start reading the labels on foods you eat. Any added sugars should be looked at as toxic, because they are. They are extremely pro-inflammatory and lead to the systemic inflammation linked to joint disease, cardiovascular disease, diabetes, and dementia. And I know your health is important to you and to your family, friends, and loved ones. So these messages are important, and we are trying to raise awareness in the community of what can be done to prevent knee problems, and even more importantly, how to slow this destructive process that is so prevalent in our society. Well, that concludes this episode. Thank you so much for joining me, and I hope to see you on a future segment as we strive to improve the health in our communities, one knee at a time.
Well, it's good to be alive. So good to be alive. This feeling's running